Hello, my name is Allie Wagler, and today I'm going to be presenting to you about rheumatic fever. Imagine a child with a simple sore throat left untreated. It silently evolves into a disease that scars their heart forever. Sounds extreme. That's exactly what rheumatic fever can do. I'm going to walk you through a disease that's both preventable and powerful, which is rheumatic fever. By the end of this presentation, you'll understand what rheumatic fever is, what causes it, and how it affects the body, the treatments available, and most importantly, how can we prevent it. Let's dive in. Rheumatic fever is not an infection itself, but a serious inflammatory disease that develops as a complication of untreated strep throat or scarlet fever. It can attack the heart, joints, brain, and skin. And in severe cases, it can cause lifelong heart damage. It's like your immune system misfires and turns against your own body. Down to the right is a visual photo of a child with scarlet fever or inflamed joints. The villain behind the curtain is a bacterium called Streptococcus pyogenes, or Group A Streptococcus. This bacterium spreads through respiratory droplets, coughs, sneezes, and shared utensils, you name it. If strep throat is left untreated, the immune system's response can go rogue, leading to rheumatic fever. I included a visual down on the right side of a microscopic image of Streptococcus pyogenes. It's grouped in chains, and it is a bacterium. Here's the scary part. Your immune system can't tell the difference between the strep bacteria and your own tissues. This phenomenon is called molecular mimicry. As a result, your body starts attacking healthy tissues, especially the heart valves, joints, and even the central nervous system. Down below is a diagram showing immune cross-reactivity. Symptoms of rheumatic fever. Symptoms vary, but here are the most common red flags. Fever, fatigue, swollen, painful joints that move around the body, red skin rash or nodules, chest pain or heart murmurs, and something called chorea, jerky, involuntary movements, which can be distressing to see. The visual down to the right is an image of a rash or inflamed joints. When we think of heart problems, we usually imagine older adults, but rheumatic fever targets a very different group, kids. According to the CDC, children aged 5 to 15 are most at risk, especially those living in crowded conditions or areas with limited access to health care. Why? Because rheumatic fever often follows untreated strep throat, something that seems minor but can cause serious, lasting damage to the heart if ignored. It's not just about illness, it's about awareness. By recognizing who's most at risk, we can act early, treat fast, and prevent long-term harm. A simple sore throat should not steal a child's future. I added a chart down to the bottom of the high-risk groups for rheumatic fever. Children aged 5 to 15 are the highest, leading at 40%. Diagnosis criteria. Doctors use something called the Jones criteria, which separates major and minor symptoms, but diagnosis always requires proof of a recent strep infection, either from a throat swab or blood tests like ESR, CRP, or ASO. The visual down to the right is the chart showing the Jones criteria. Treatment. Here's the good news. Rheumatic fever is treatable. First-line treatment is penicillin, which is a powerful antibiotic that destroys the strep's bacteria's cell wall. Then come anti-inflammatories like aspirin or corticosteroids to calm the immune response. And for some patients, long-term penicillin injections, monthly, for years, to prevent recurrence. According to the CDC, early treatment drastically reduces the risk of permanent heart damage. The visual down to the right is the penicillin molecule or injection schedule chart. Effects of treatment. Stops immune response by eliminating bacteria, prevents long-term damage to heart vessels, reduces inflammation and pain. The visual down on the right side is before and after image of heart or joints, normal versus inflamed. If untreated, rheumatic fever can lead to rheumatic heart disease, which causes permanent valve damage, heart failure, or even stroke. This is why prevention and early treatment are crucial, especially in underserved areas where access to healthcare may be limited. The image down on the right is a heart valve diagram showing RHD. Prevention. So, the question is, how do we stop it? Treat strep throat early with antibiotics, raise awareness in high-risk communities, encourage routine throat swabs in schools and clinics, educate parents, teachers, and caregivers about symptoms. Simple steps like these can save hearts, literally. The visual down below is a child getting a throat swab. Here is the summary of rheumatic fever. Rheumatic fever might sound like something from the past, but it's still very real and very preventable. It starts with something as common as strep throat caused by group A Streptococcus bacteria, but if left untreated, that sore throat can trigger a dangerous chain reaction in the body, leading to painful joints, inflammation, and even long-term heart damage. The good news, it's completely avoidable. With early diagnosis, a simple round of penicillin and some anti-inflammatory medicine can stop it in its tracks. That's why awareness is everything. When we know the signs and take strep throat seriously, we can protect our hearts, literally. Here's my works cited for more information on rheumatic fever. Thank you for listening.